Hi, I'm your host, Dale Sherbeck, and welcome to the HQ podcast. For those tuning in for the first time, the HQ is a podcast serial produced by CHA Learning and is your trusted source for important conversations on healthcare issues and topics from those that are leading and impacting the health system. Together, we'll explore these topics as we continue to learn together. CHA Learning is the professional development division of Healthcare Can and is uniquely Canada's only national fully online learning provider serving all of healthcare. So please check out more about our learning programs and services after this episode and discover how we collaborate with health leaders and organizations like those we feature on the HQ to empower healthcare professionals with the knowledge, skills, and relationships to impact health system improvement. Thank you, listeners, for joining me today for what will be a fascinating and very important conversation. Today, we're going to talk about HR, what it is, what it isn't, and what it can be, especially in the context of being a strategic leader for transformation. This is a really important conversation, and all the more timely as we navigate a profound period of global and economic uncertainty. Why does that matter? Well, according to CIHI, health spending in Canada was $372 billion in 2024, and our health workforce accounts for roughly two-thirds of this. And if history has taught us about anything about HR, it is that HR budgets are very vulnerable during economic downturns, and all the more true in a health sector, which is a people business. I dare say every one of you listeners has had some experience with an HR process or person. You've been recruited, compensated, evaluated, developed, celebrated, or promoted, and perhaps even let go. But much of what I've just enumerated describes a very transactional relationship with a professional function that is often taken for granted and which, as you'll hear, is very much more than these tactics and needs to be much more than this as we talk about transformation and innovation. In healthcare, HR often gets linked or becomes synonymous with HHR, a topic central to the HQ. So you've often heard me use the term as I've had conversations about a workforce crisis or challenge, and the HHR professionals who are spending a lot of time trying to fill vacancies and ensure the health system can continue to run. While recruitment remains an important priority in healthcare, on the other end of the continuum, we've then spoken at great length about the challenges of workforce wellness and satisfaction, and how much more critical retention needs to be for sustaining our system. How that is accomplished is very much a strategic function, one which is led by HR executives who have increasingly adopted titles as VPs of People and Culture to reflect their strategic mandate. So I'm very pleased to be joined today by two such highly respected HR professionals who are very much part of that transformational leadership team in their systems. First, I'm pleased to welcome Anna Marenick, Vice President of People and Culture and Belonging from Nova Scotia Health. Anna is a successful human resources and transformational leader with extensive regional and national experience. She has led multifaceted and complex programs in diverse and challenging environments in both the private and public sector. Prior to joining Nova Scotia Health in 2021, she was the Senior Director of People and Governance at Develop Nova Scotia. Her creative and inclusive approach to solving complex problems in a variety of settings makes her exceptional at collaboratively propelling ideas and people forward. She sits on the board of directors of St. Mary University and Neptune Theatre, and she's also actively involved in the Governor-General's Canadian Leadership Conference. Earlier this year, at the Nova Scotia Chartered Professional in HR Awards, Anna was presented with the Union Partnership Award, and the Nova Scotia Health team was presented with the Team of the Year Award. Anna has an MBA from St. Mary's University and a Bachelor of Arts in Political Science from St. Francis Xavier University. She is also a ProSci certified change management professional and a chartered professional in human resources. Next, it is a huge pleasure to have with us Sarah Cameron, who is Chief of People Strategy and Technology at Covenant Health in Alberta, where she leads human resources, strategic planning, communications, and technology initiatives across the organization. Since joining Covenant Health's executive team in October 2022, Sarah has brought extensive experience in corporate strategy, organizational development, and transformational leadership. Prior to her current role, Sarah served as the Chief Human Resource Officer for the City of Saskatoon, where she owned her expertise in talent management, leadership development, and driving organizational change at scale. Throughout her career, she has specialized in helping organizations enhance their performance and effectiveness through strategic people-focused initiatives. Sarah is passionate about the power of relationships and collaboration in solving complex challenges and creating meaningful change. She believes in fostering healthy, inclusive work environments that empower teams to deliver their best work in service of the communities they serve. So, hi, Anna and Sarah, and welcome to the HQ.
Hi, Dale. Nice to see you.
Great to be here.
So I'm very grateful for you both taking time out of your very busy schedules and many of the priorities that you're facing in the context of the conversation about our workforce. But I'm wondering maybe, Anna, we can start the conversation in setting that context that was part of the introduction here about what is the business of HR in your view, and what is that traditional view of HR in healthcare, and how do you distinguish it from HHR?
I think the changing business of HR is not one that I think is unique to healthcare. I think that it is changing almost everywhere
Mm-hmm.
for a variety of reasons. Um, and I think HR has traditionally been seen as a portfolio in an organization that focused on more administrative, technical um, workflows to make sure that you were managing a collective agreement, that you were recruiting people. So it wasn't really seen as a partner, it was more as a requirement to maintain legislative compliance and transactionally hire the people that you needed to hire.
Mm-hmm.
It wasn't seen as a strategic partner to the organization. I think that was true in any industry, not just in healthcare. I think part of why it's changing, and it is a really interesting and exciting time to be in HR anywhere, is in healthcare, from my experience, which is limited compared to most, I I see that people get attracted to the sector of healthcare.
Mm-hmm.
People go to school because they want to be a nurse or they want to be a physiotherapist. So the employer was less of a consideration for someone when they were looking at a career in health. I think now, as we really get our heads around the talent shortage and the talent pressures that we find ourselves in, that no longer is sufficient. So I think it is requiring HR to play a different role at the table about the role and elevate the role that employee experience plays, not just attraction to the profession that someone wanted to seek. I think it's different from HHR because often when we talk about HHR, the conversation tends to be around workforce planning and clinical workforce planning. How are we looking at supply and demand factors to make sure that we are graduating enough nurses and physicians to meet the complex and growing needs of our patient population at anywhere in the country, which is important. However, I think that that is only one slice of the role that HR and supporting people in the way that it is defined everywhere and changing in other sectors. I think there's an opportunity for us to elevate the conversation past just looking at workforce supply and demand.
Thanks, Anna. So I see you nodding your head, Sarah. So anything you'd like to add to that, and perhaps even in further defining in your view, what HR is not?
Yeah, I agree with everything that Anna said. So it can just check all the boxes for me. I think this is not a healthcare specific problem. It is a evolution of the world of work problem, that HR is struggling to catch up with what we need to be in order to serve the businesses of the future. In terms of HHR, I do think it tends to be fairly narrowly scoped, as Anna described, to looking at workforce forecasting and actually very narrowly focused on immediate need recruiting,
Mm-hmm.
which doesn't take into account the systemic nature of the workforce, looking at pipelines, identifying future workforce needs, and figuring out how we're going to make sure that we have the workers we need, not just today, but in the future. And getting people here is only one part of the problem. We need to have a workplace that they actually want to come to, where they have a sense of hope that they'll be cared for, and that they can thrive in that work environment, which I think healthcare does have a unique struggle in terms of trying to position itself this way. And so therefore, just focusing on the workforce planning, forecasting, and recruitment aspect, I think is probably gonna not serve us as well as we would like to, looking out into the future.
Thanks, Sarah. So I think you're both leading into sort of that next part of the question in terms of looking through the lens of today. Why does HR need to be more different? Like, what is that evolutionary sort of trajectory for it, and what is it responding to?
Yeah. I think I think when I look at the HR education programs, they're still quite narrowly focused on this very sort of technical description of what HR is and a set of skills, as opposed to looking more broadly at a broad set of business skills that are actually required to influence the business. And I think that, in terms of where HR is going and where HR needs to go, is into that realm. We need to be looking at disciplines outside of HR and bringing those into our practice, whether that be strategy, whether that be technology, whether it be looking to the future of AI, looking at the future of business, all of these things, sociology, culture, like these are all practices and disciplines
Mm-hmm.
that our HR practitioners need to become well versed in, as opposed to just sort of the technical playbook of what is traditionally called HR. Because this chicken and egg cycle of like, we only have so much to offer, the business wants more. We try to give solutions, but with a very limited toolkit, then we're seen as not valuable. It just creates this cycle where we can't seem to get out of. I think we can see that we need to do more, but I'm not sure as a profession we understand really how to think differently, and we seem to have a little bit of fear of broadening our scope and bringing in other practices and other disciplines to make sure that the people doing the work are more holistic. Like for my team, for example, a lot of the new leaders that I've hired are not necessarily traditional HR leaders. Yes, they all have some expertise, but a lot of them have worked outside of HR, inside of HR, and they have that broader business expertise and experience. And that's what's allowing us to think differently about what we bring to the organization.
Makes sense.
I think the truth is that this is a very complex field. There is a lot of complexities inside the field of HR that people might not always see. There is an increasing legislative landscape that is happening as a result of changes in legislative acts around occupational health and safety, workplace wellness, which are all great and really important. So there is always a component of compliance and enforcement that are in place whenever you're doing anything related to collective bargaining or legislation around workplace. They're all there. And I think that expectations of people coming into the workplace are changing. I think that's true. Every generation kind of comes to a workplace with different sets of expectations.
Mm-hmm.
But now we've got complexities coming out of COVID, people looking for different things that maybe the system can't easily adapt to in the same way. We, through amalgamations in health, are running very large organizations now too. Nova Scotia Health is the largest organization in the province. So there's complexities that come from doing HR in a large organization of any kind, let alone
Mm-hmm.
healthcare. And you've got pressures around technology integration, seamlessness of service. So you're balancing a lot of different expectations where you've got different demands coming from the entrance into the workforce, diversification of people coming into the workforce, global shortages around resources that we can hire. These complexities provide a real opportunity for HR functions in organizations to lean in differently. But that also, there is also, I think, an opportunity for more education and awareness on the role that we can and should play as professionals. We can't just expect that because we live in the world of HR that people naturally understand how we can be helpful. And I think that conversations like this are really important to help set that context, and also helping people understand what a career coming into HR could look like today, that, to your point, Sarah, might be different than what they're seeing through a traditional education.
Yeah, and I know that early in my career, an HR person sort of described the function to me as we're hiring for skills and we fire for fit sort of approach to things. And but I think what you're describing is a lot more complexity to that. I think, and that there's especially I think as you described, Anna, the new generation coming in, it's not just saying, well, this is our organization, this is our culture, you need to adapt and fit to that. I think what you're saying is that you need to start challenging the culture of the organization itself and create a space that people want to work.
Yes, because now interviews are the playing field is a lot more even than it ever was, right? Candidates will interview us too. So
Mm-hmm.
Yeah.
back to my earlier point, I think that for people who really wanted to do frontline healthcare, who they worked for, I don't think was as much of a calculation as it is now. Now employee experience really matters,
Mm-hmm.
which leads us down into having to have different conversations strategically about how the organization performs its work, not just about the skills that someone was taught in whatever school they went to do frontline nursing. That matters. And it's hard always to make the case for those things to have an investment like we would want to see in something that is clinical and front facing, which makes perfect sense. We want to be investing in healthcare in ways that people can see tangibly. So when you think about how you advocate for investments in things that will improve workplace culture that you believe will have a long-term impact, you have to come at it a different way. It is really important to think about how you do that. But I think that that's the opportunity for healthcare, people in HR and healthcare in today's environment, is really to figure out how to advocate for things that will ultimately have clinical impact, even if they're not as direct as they might be in some of the other cases that we would want to bring forward.
Thanks, Anna. So you're both part of Healthcare Can's Health Human Resource Advisory Committee, which I appreciate in the context of the distinction you were making between HR and HHR. Perhaps needs a bit of a rethink and a rebrand. But that said, it emerged at the beginning of the pandemic. The committee certainly was in front of identifying critical workforce priorities, including recruitment, wellness, and retention, and leading the way as we look at national solutions and approaches. So where does HR as a strategic and transformative pillar or lever fit into this in your views? Maybe I'll start with you, Sarah.
Well, I think, my experience joining the committee, obviously it's already been underway for a while by the time I joined. I think it's of huge benefit for HR leaders in the healthcare sector to be coming together and discussing the challenges because our challenges are very similar. Some of us are taking similar approaches, but some of us are doing some new and unique things, and being able to hear about that and build on those successes, I think it's really important in terms of evolving the practice more broadly. Where I think we have room to grow is I think just as HHR in the healthcare sector has been quite narrowly focused on this immediate workforce gap and how do we get the workers to fill in those core gaps. I think there's so much more we could be talking about in that group when it comes to things like what is the function of HR? How do we add value? What do HR skills of the future look like? What kind of teams do we need to be building to support the organization? How do we build more credibility in the organizations that we're trying to support? Looking at things like what does a healthy workplace look like? Because Anna mentioned the newer generation of workers, and I agree with her 100%. But they're not the only ones whose expectations are different.
Mm-hmm.
Workers who've been around longer, like us, and people who are older than us, we have so much access to information and education. We are aware of what's out there, and everybody's expectations are changing. We're all elevating what we expect from our employer, what we expect from our colleagues, what we expect from our workplace. I read some interesting research recently about, looking at the workplace of the future. Workers want to come to a place where they can be their whole selves. The time when you just come with your skill set to do your job and the rest of your life happens somewhere, that's over. And people want to be in places where they're recognized as being, whole people, and where they can bring that uniqueness to work, but also where work has some accommodation for the fact that, we are working within a life that sometimes has complexities. And we haven't traditionally always been good at that. And HR practices have not always been really good at that, because it does, especially in a highly unionized environment with so many collective bargaining agreements and so many things written down, making change can be really challenging. So even the skill set around building partnerships with our unions and helping to understand what's really important to their workforce and looking for collaborative ways that we can move forward together. I think this is a very important skill set that in the past has been sort of the job of LR. That's LR's job to work with the unions. Well, it's not LR's job. All of our employees, or the majority of our employees, are unionized. We all have to be well versed in how to build collaborative relationships, how to do interest-based negotiations, how to find common ground and work together within these environments for the betterment of the organization, build trust with each other, because that's where change happens. So I think there's just so many more things we could be talking about in that group that will impact our ability to address the very critical workforce shortages that we're all facing.
Super. Thanks, Sarah. Anything you want to add to that, Anna?
Um, I think the conversations that we're having nationally, there are lots of places where we can lend our voices to a conversation that is not unique to any jurisdiction that we're in,
Mm-hmm.
which is sometimes it's, you leave going, it's really too bad that this conversation is one that is national, because the challenges that we're facing, we're all facing them.
Mm-hmm.
We may have different levers that we can pull to improve it, or different reasons that got us where we got. But it, I think if we can continue to find ways to use our collective voice to help support each other, that helps support our organizations, and then make sure that we're looking at ways to shine a light on some of these things as a way to help advance how healthcare is delivered in our provinces and country. I think that's the opportunity. So even though the Health Human Resource Committee um, by title looks to be narrow in focus, the conversations have not been.
Mm-hmm.
And I
Yeah.
think we've naturally, just because we understand the complexities and the large scope that we're working with every day, I think we've naturally found ways to bring that conversation to light. And I think Healthcare Can is increasingly understanding the role that it can play in helping to advance this part of the conversation.
Thanks, Anna. So I think in previous conversations with you both, you've mentioned something called a strategic HR backbone. And so maybe you could just sort of tease that out a little bit more. What does that mean to you? What does it include? Um, Maybe start with you again, Anna, on that.
As we've talked about, there's so much complexity to the field of HR. For me, having a strategy that integrates all of the different components of HR allows us to engage with the organization in a way that helps address the problem that they really have, not just answer the question that was asked of us.
Mm-hmm.
Because when we answer the question that is asked of us, the assumption there is that that was the correct question to have been answered in the first place.
Yeah.
So, and I know for my team, and I'm sure this is true for Sarah as well, you can't be in HR in healthcare and not deeply care about the work that you're doing. I have never worked with a more dedicated and passionate, loyal group of HR professionals.
Mm-hmm.
So they want to help. And sometimes we don't give ourselves enough space between the ask to help and the solution and offer to help. So the more that we can come back as a service and make sure that we are learning how to integrate with all of the components of HR, think about the question, how we come to the table with curiosity, not just a quick solution.
Mm-hmm.
To me, that's part of how we evolve the HR backbone. So we are actually helping understand what the issues are and the opportunities, not just addressing problems as they are presented to us. There's a lot of unintended consequences there sometimes. So, with
Mm-hmm.
the best of intentions, if we do something in isolation of another part of HR, let alone other parts of the organization, sometimes we're missing an opportunity to be that force multiplier that I think we can be. So it's really teaching the organization to interact within itself, within HR, let alone before we go out and have conversations with our partners. When we've given ourselves a little bit of space to do that, I feel like we've made better decisions. And it's through those moments that matter with our customers, I think we are starting to demonstrate the value that we can add. So that to me is part of what I think the value of the strategic HR backbone can be.
Yeah, makes
I
sense.
just agree with you 100%, Anna. I think we've started to see a big shift at Covenant in the HR space when as we have talked to our HR team about the the burning desire to give a solution and to solve somebody's problem. Um, when that has been the measure of success, that I've solved your problem, what that leads to is bringing forward solutions that don't actually tackle the root cause of the problem, but it also leads to burnout for our HR staff and this feeling of complete overwhelm. And this idea that we need more and more and more people because we can never get to the strategic work because we're so busy doing the tactical work. And when we can start to show to our people, our teams, our HR professionals, that by not jumping to the solution, just as Anna said, taking that deep breath, bringing it back to the table, building the skills around curiosity, asking questions, bringing in other sources of information like strategic inquiry, even looking at things like using health and safety root cause analysis to help us really work with our operations partners to dig down and find out, this is the problem that's presenting itself, but what's really underneath it and where can we start to tackle things that will create long-term impact. That's where we start to build credibility because our operations leaders start to go like, wow, I had no idea that was even possible. They've felt accountable for coming up with not only the problem, but also the solution and asking us to execute it. And what we're trying to shift the mindset around is like, bring us your problem. We'll bring together some multidisciplinary people. We'll ask some really great questions. And then together we'll try and get at what the real problem is. And we'll bring forward something that's a bit more creative, more sustainable. And sometimes the easy solution is the best one. That's totally fine. But let's make sure we understand what we're solving for. So that we don't keep solving the same problem over and over and over and over again, wasting time and resources, creating jobs for HR people that are so unsatisfying,
Mm-hmm.
and instead really getting to the meat of the problem and making an impact where this problem isn't a problem anymore. Maybe there's a new one for us to solve, but at least we're not solving the same one over and over again.
Yeah, there's nothing more frustrating than watching the carousel come around and around each time.
Yeah.
But yeah, and I can certainly relate. I mean, in my own background and sort of, learning and development, it was always, people coming and saying, I need a course for this, right? I need
On this.
right? I need, this is the solution. And then you'd
Yeah.
stop, if you could just teach people this, then we wouldn't have this problem. In most cases, training and learning wasn't the root cause. It could be right? The user interface of something else. It could be policies, procedures. It could be culture, anything. So yeah, I think exactly that. Certainly position yourself as a strategic resource, as a partner. I think as you described, and not an order taker at a takeout window saying, do you want fries with this? So
Well, and we've been rewarded for that behavior over time. We reward ourselves for it. We say, like, oh, good job, you solved that problem. Oh, I feel good, I solved this problem. And we've been rewarded by the business saying, like, well, I always go to Kathy because Kathy always solves my problem. But what we don't do is actually understand what's behind that problem and solve it permanently. And we also create so much burnout because Kathy is constantly trying to solve everybody's problem. Meanwhile, all this other work is piling up and she doesn't get to use her, like the breadth of her skills and her thought process or the ability to collaborate across. I love your example. I think it's a perfect practical example of what we're talking about, Dale.
Well, and whether you have practical expertise in compensation and benefits or labor relations or recruiting, from the perspective of the customer, they don't care.
Yeah.
We are all people services and need to have enough breadth to be able to help them with these problems. Because in a lot of cases, they're coming to us for something that matters. So we need to understand enough about all of the complexities of the work that we do to make sure that we are teaching our customers how to engage with us differently and earlier too. I would much prefer to be in a situation where we're trying to figure out proactively what options we have to solve a problem. It's way harder to do that if we're at the table late, which I think has been traditionally how people have interacted with HR. We are the last cog in the wheel to execute on something that has already been decided. And in our world, it doesn't work that way anymore. So how do we creatively demonstrate different value so that we're not someone that you come to when you have to check a box at the end? It's really about what options you have. Because sometimes we don't have very many. And for me, I would say that is one of the most frustrating parts of my job is that often these environments are complex. There are a lot of reasons why we can't necessarily do something that might seem really obvious and simple to one person or one leader. So the more we can have conversations, not from a place of can and can't, but how can we? What are our options? And they're much easier if we can have those as early as possible. So we're teaching at Nova Scotia Health, we're teaching the team how to do HR in an integrated way, and then also trying to educate our customers at the same way, which is such an amazing opportunity. You're also trying to do it while we're going 1,000 miles an hour
yeah.
to transform a healthcare system that is also, at capacity. So it's a lot, but I think that we do see lots of glimmers of success, and those are the ones that you have to hang on to that keep you coming back and moving forward.
So inspiring conversation. So Sarah, I mean, what's getting in the way of this? I mean, why doesn't this come more naturally to? I mean, we're talking about healthcare organizations. I appreciate from your earlier comments this is probably true of most organizations, but what is getting in the way of this being more the way HR is done in our sector across the country?
I mean, healthcare being a publicly funded sector, I see this challenge across all kinds of publicly funded sectors where the funders are very focused on ensuring frontline impact and delivery of service with dollars. And there becomes this real hesitancy to invest in um, the work that happens behind the scenes to support that work. And that's why it's broader than healthcare, because how do you invest in something that's not delivering frontline services? How do you explain that to the taxpayer? So I think over many, many decades, HR has been underfunded and underinvested in terms of the evolution because it was understood as a practice that all you do is hire, manage the collective bargaining agreements, help us out when employees become problematic. It's very transactional. So we've over time we've told ourselves that that's what HR is. We've hired people for those skill sets. We have we've really limited the work of HR. We haven't allowed HR to mature within these organizations until now you hit a point of crisis
Hmm.
with this workforce crisis. And then all of a sudden, everybody's looking around and going, HR, you need to be the ones to help us with this. This is a people crisis. And I don't know about your organization, Anna, but in my organization, HR was going, what? I don't know how to do that. What are they talking about? They're used to doing the very administrative transactional work. And so they don't have the skill set, the tools, the mindset, and they haven't had the support to be able to enter into those conversations. So the organization has created this huge mismatch of what they have prioritized and valued and grown in the HR space versus now the need. And so now we're being asked to like quickly shift and transform. But again, where is the investment? It's not in adding technology to HR, for example, because there's just when you work in organizations like ours, you work with a lot of people who have always worked in organizations like ours. And so haven't had a lot of exposure to what's happening in other organizations that are more progressive in this space. So making the business case for why an investment in, an HRIS system to improve employee experience, why that's going to help us, why an investment in something very expensive and labor intensive like culture work or leadership development is going to help us solve the workforce crisis. These are hard conversations for us to have because we're not talking with leaders who have a lot of experience already and tangible, practical results where they can say like, "Oh yes, I've experienced that in the past. That's a good place for us to invest." They're kind of going like, "Well, I don't know. I've never seen that. I've never heard of it. Are you sure it would really deliver that much? How do I defend that to the people who are asking for us to have more nurses or that where we need technologies for basic healthcare on the front lines? Making those trade-off decisions is very challenging for an organization. And as executive leaders, I mean, Anna and I sit at those tables and are part of those conversations. So we know how hard it is to make that decision. And how important it is that our business cases are very, very solid, and that we do the work when it comes to relationship building and credibility building across HR so that when we come with these asks, there is an openness to thinking about HR differently than what it's been thought of in the past. But, I think those are some of the key things we're up against.
Yeah. So you've teed up the question perfectly for Anna with respect to then. So how do you build that business case? How do you, how do you answer the question of the ROI and, get other leaders who may be clinical in their backgrounds to get on board with the importance of making these investments?
Um, One of my earliest mentors taught me, and not in healthcare, taught me a lot. But one of the things that I learned from him was really that the best HR people understand the business that they are working in.
Mm-hmm.
So I think that is a really important step in making sure we're not healthcare providers, but we can't be seen as trying to drive anything that we're doing, an improvement initiative or an issue in compliance or bargaining, if it's being done to the business. And I don't see enough yet of HR professionals using data to inform decisions and shaping a problem through the lens of their client.
Mm-hmm.
And I think by not doing that, we sell our ability to contribute really short because it seems disconnected from the day-to-day realities that our frontline leaders are facing. And I can't imagine what our operational leaders and our frontline clinicians face every day. But I think if we aren't seen as someone who knows how to help them solve a problem in a way that they see that problem. So that is a real challenge for HR folks in general, is we think about the problem through either our own lens or the lens of our employees, or often look at things that are getting in our way. So we've had decent success in a couple of places in our team where we had a problem that we were trying to solve, and everyone always defaults back to, well, we need more people. We can't do this without people.
Mm-hmm.
So when we had a defined scope, we knew that there was an opportunity here just within our people services team, and we brought the team together to identify ways in which we could interact with this particular issue to see how much improvement we could make without adding any additional people. And the results that we had um, were pretty significant in our ability to improve output in a certain area just by having people rethink the problem. We talk a lot about finding ways that we are watering artificial flowers. There are things that we are doing that actually aren't adding value that we probably just need to take a pause and stop doing. No judgment, not, to Sarah's point, there are lots of people who've engaged with the system for a long time and have done things they've always done. Let's give ourselves permission to stop and think about it differently so that we can tackle the problem better, because continuing to throw more people at it, there's a shortage of talent in HR world too.
Mm-hmm.
So we need to make sure that we are helping our HR staff identify problems differently, identify solutions differently, interact with data differently. And I think that that's the value of coming in from a different organization, when you can take some different approaches to solving problems that I think for people who've been around for a long time, you might not notice as easily as you might coming from the outside. So for us, I think it is using data, thinking about the problem differently, bringing people together to solve their own problems. To me, that's been a key to any of the improvements that we've had so far. That's been a big contributor.
Thanks, Anna. So I think nested in there is another question then for you, Sarah. So, how do you get to be the kinds of leaders that you both are in terms of your backgrounds? I mean, you've talked about your mentors, but I mean, is there a playbook that you're given in this context? You're both relatively new to healthcare, both in the last 4 years, to your organizations, coming from outside of healthcare in that context, and yet you're thriving in the space today. So, do you have to be a healthcare expert? You've talked about it's important to understand the business, Anna. So I guess really, how do you become the people you are, and what was necessary to achieve that, Sarah?
Hmm. Oh, that could be a great book. Yeah, how did I become the person that I am? I don't know, Dale, that's a pretty deep question. But I think, in terms of being a transformational HR leader that's hopped from industry to industry, I think there is definitely no playbook. There's definitely no course you can take. Do you have to be a healthcare expert to come into this job? No, you do not. What you have to have is really big ears. And you have to take time to listen, to hear. I have to rely on your operational and long-term employees to inform you about what the problems are. To Anna's point, you can't be the one with all the solutions. I have a lot of experiences I've collected over time. My ability to sort of sift and sort through all those experiences and nuggets of learning, and then really listen deeply to where the organization is at, and ask those really broad yet deep probing questions to find where the issue is, and then bring together, sift and sort through all those things in your toolbox and go, you know what, I think there's a nugget here from something else I've done that might work here. Or if I knit this piece and this piece together with my operational colleagues, I think we might have something here. So I really do think that the ability to be a really transformational leader is about living in a space of hope and optimism, while also being firmly grounded in realism. So, really understanding the constraints and the realities of the operations that we're supporting. To Anna's point, learning about the business that we are in and relying on our operational partners to inform us about what they really need. And then having the experience of being in multiple different organizations and trying to affect change, sometimes successfully and sometimes not, and bringing those learnings and those experiences together to see how can we build something really creative here, and always focusing on the possible, the art of the possible. Because I think if you get to the point where you think I've done it all and seen it all and this will never work, you're long past the point where you can be a leader in transformation. You have to always be the one who sees a possible path forward and is willing to take the risk to stand out there and say, hey guys, I think this is the path. Let's try and take a few steps down here, and see if we can get there.
Thanks, Sarah. Inspirational. Um, it's a good answer. You don't have to write the book. Um, so, um, so building on that a little bit, Anna, I mean, in your bio, we talked about your recent awards in recognition in terms of the work that you're doing in Nova Scotia. How would you define success, and what does success look like for organizations, that are following this transformational HR leader sort of approach?
It's a really challenging question because it's, I don't think the work that we're doing will ever be done.
Mm-hmm.
So this role has challenged me to figure out how to define success in different ways.
Mm-hmm.
Um, and it is hard when the pressures and demands that we all have of users of a system can it's um it's not likely to stop when we're in this position. There's always going to be a demand for more and faster and better, which makes perfect sense, right? We are all in a place where healthcare and healthcare delivery and transformation is really important. You can feel the weight of that.
Mm-hmm.
um and but um I'm really proud of um the journey that my team has chosen to follow me on. I don't take that for granted.
Mm-hmm.
And the opportunity to rethink how we do our work in service of making the organization better is not an easy one. And I don't take that for granted. So to have the opportunity to even just be considered for, the award wasn't about the award. It was more a reminder to us that we're trying to do the hard things and we're trying to do them as best we can because we believe in what we're doing. And that was pretty exciting for me.
Mm-hmm.
And it helped the team propel so that we can keep coming back and turning over more rocks and finding more things that we need. And we found different ways to have different conversations with partners. We've got, a different relationship with government that is, challenging us to find new ways and creative ways to do things differently, which is great. When we are bringing union partners and other partners to the table to have different conversations, there can be a lot of othering in health, and a lot of belief that people either don't think that we know that there are problems or we do know and then don't care. So the more conversations that we can have face to face, really engaging with people all across the system, frontline leaders, frontline healthcare providers, to really understand from their perspective and also try to have them understand from ours too. It really is in my view, the only way that we can get to a place of common understanding so that we're not all feeling like we're working against each other. And it is harder and it's really time consuming, but I really believe that it is the way that we get transformation. Um, when people don't feel like we are working against each other or that we've got side agendas, it really matters. And it matters to me. It's a lot of the reason why I wanted to do this work is because I didn't want to do it to people. I wanted to see how I could do it with people to make my home province better.
Mm-hmm.
Not successful all the time, but I won't give up trying. And I think the more that any partner that we sees that genuine intent to come to the table to try to help even a little bit, I think we'll all be better for it. And I think just because it's hard, it makes the connections that we have and the relationships that we build with other HR leaders across the country or other partners like that.
Yep.
It's helpful for all of us to keep going and to sustain the momentum that we need to keep trying to transform and get better.
Yeah, we have to do the hard work to get to those kinds of relationships, right? And it is, I think, as we talk about leadership or and the work that you're doing, I mean, it's relational, and I think that's a lot of the investments that you're making in that space. So it's great.
We talked a little, I know we've talked about this before about when we took an approach to do interest-based negotiations with our nurses, which as opposed to traditional bargaining where you're sitting in separate rooms and sending documents back and forth, we sat in one room for months
Mm-hmm.
with direct with staff. And it was fascinating to watch because when we got to a point where we were having some conversations, if you didn't know, you wouldn't know who was a member of the union's bargaining committee or who was a member of the employer's bargaining committee. It was really fascinating to see how those relationships morphed and changed because there was no persona. We
Yeah.
were people who were really digging in, and the barrier that has often been present in situations like that just wasn't there the same way. And I remember at the end, this nurse who had over 50 years of nursing experience in the organization at the end came up and gave me a hug, which doesn't often happen after bargaining. And she said, "You are not the enemy." And I will never forget that she said that because it just reminded me again, like she has an image in her mind of someone like me.
Mm-hmm.
And those are some ways that if, where we get in our own way in service of a transformation, it's easier to go back and do things the way that we had always done them. But how do we challenge ourselves to figure out different, creative, more partnerful ways to do things? We will not always agree. You can't have a relationship with the partner and think that it's going to be smooth sailing all the time. But you still got to keep coming back and trying to have the conversations because I think we're all in healthcare because we care.
Mm-hmm.
So how we get aligned on what solutions are, those things I think can go a long way if you can continue to find spaces big and large to do more of that.
Thanks, Anna. Great examples there. Sarah, anything you wanted to add from your perspective in terms of what success looks like for you?
Success for me is the small wins, because it's a number, you know, when you're looking ahead at the journey you need to go on, it feels so big, and it feels so daunting. But when we can look back and see, we've taken 3 steps forward or 5 steps forward, we still may be a long way from the goal that we want to, but these are small successes that build the pathway to the bigger transformation. So to me, it's really success is looking where we've come from and the steps that we've taken towards the goal, like the big juicy goal, and seeing that we've made progress. It's also the things like Anna says when somebody, when I hear one of my colleagues say around the executive table, Director X, wow, are they amazing on your team? The solutions that they're bringing me, I've never seen things like that before, and I feel so supported. Little comments like that, okay, we may not be solving all the problems of HR, but we're making a difference and we're making progress. We're building credibility, we're building trust, we're building a reputation as a valuable part of the organization that brings different and credible solutions. And that is a foundation that we can build transformation on. So, yeah, to me, those are the successes that count the most right now.
Thanks, Sarah. Yeah, and I'm reminded, I mean, we had the pleasure of meeting the new health minister last week as well, who engaged with our members and community. And, I think the one thing I heard her say to us and to many people she was meeting was just that we have to do things different, right? Was a key refrain that she kept articulating, because that the challenges around workforce that we're facing are not going to be resolved by doing the same thing that we've been doing over and over again. And so I think it certainly echoes, I think, the points that you're both making in this, in terms of what success will look like. So, notwithstanding that, we are at I don't know if the buzzword for 2025, an inflection point. Certainly, Trump has destabilized so many things, but it's not just him. But but all that's breeding, a lot of economic uncertainty within our country, within our provinces and regions, and our healthcare organizations, as certainly as large users of our public purse, are a big part of that discussion. So, notwithstanding that we've been talking about and that we're still in a workforce challenge in terms of not having enough people, we're now entering at the same time, it seems like a phase of rationalization, and people asking to tighten the purse. And given that, some people, I guess, continue to see HR as a cost center, how is that showing up for you, and how will you sort of continue to sort of articulate the importance of your roles and the work that you're doing in this space, as perhaps some of your colleagues around the country would disappear and swallowed up as new roles? So, Anna.
I think it has to start with us knowing our worth and the value that we are bringing to the organization. But as I said earlier, we also have to be prepared to bring it.
Mm-hmm.
Yeah.
We can't afford to be precious. We all have, especially when, working in publicly funded organizations, we should have accountability to making sure that any resource in any of our team is adding the value that the organization needs added. And if we
Mm-hmm.
can't make the case about why that is having a positive net benefit on what we're trying to do, that's a problem. How are we evolving our skills and making sure, to your point, Sarah, the person who's always done things the way that they've always done them, like that won't help us continue to make the case about how we are continuing to be resources in the organization that can help positively transform how HR is or healthcare is delivered. We can't be we have to come at this from the perspective like any other function in a business would. It's not different. And I think if we aren't willing to quantify and demonstrate a value to the work that we're doing, then we'll all run that risk. So the opportunity for us is not to worry about it or get, it is a natural question that we all should be asking. So the conversation that I have with my team is, how do we get prepared for this? Let's not wait until someone asks us what the return on this might be. Let's think about it now. Let's demonstrate that in how we do reporting and how we schedule our meetings. And, but I think that those are muscles that HR has not traditionally had. And then, organizations get to make decisions that organizations make, but at least I think it's incumbent on us to make sure that we are demonstrating value in a language that the organization understands, in a way that is defensible and repeatable.
Mm-hmm.
We can't control an outcome, but we can at least make sure that someone has all the information they need to make an informed decision about the value that we have or value that we offer.
Thanks, Anna. Any comments from your side, Sarah?
I don't think I could add to that. I think you hit the nail on the head, Anna. If we haven't demonstrated value by this point, our ability to demonstrate value is at risk. And when these kind of exercises come around, which they always do in the cyclical nature of public funding, we should be being looked at, and we should be being evaluated for what we have actually delivered to the organization, and we have to perform.
I don't think that's something to be feared. I think it is
No.
something that we need to make sure that our teams see as a competency that I
Yeah.
think any enabling organization needs to be prepared to answer.
100%.
Thank you. Um, so looking ahead, um, uh, what are the, I guess, some of the current priorities in healthcare that, strategic HR leaders like yourselves and your organizations are sort of facing and focusing on today?
I mean, for us, the biggest one is the wellness of our people. Working in frontline healthcare is a taxing job.
Mm-hmm.
Having come out of the pandemic, working in a system that is struggling to meet the needs of patients, um, you know, our frontline healthcare workers are really having to put it all on the line. And it's incumbent upon us as HR and as HR executives around a table making decisions with our colleagues to focus on how do we become an organization that looks at our employees not as the means to an end, but as a valuable part of the healthcare delivery system that needs investment and needs to be seen as whole people. We know that burnout, for example, is not about whether or not you've had enough days off. Of course, that's an important part of it. But at the end of the day, burnout is mostly driven by lack of hope, lack of optimism, lack of sense of purpose, or like you're making a difference.
Mm-hmm.
And those are the things that we need to focus on because while recruitment is really important, retention of the people that are already in our system is has to be number one priority. And then creating a workplace where when we do all this work and we manage to attract some of this really scarce talent to our organizations, that we keep it because people can go anywhere and it's no longer they no longer just go where it's convenient, they go also where they feel cared for. And so, we have to help our organizations and our colleagues to understand the importance of not just caring for our patients, but patients are well cared for when the people caring for them are well cared for. And so these are the kind of strategic HR priorities that need to be top of mind.
Thanks, Sarah. Your perspective from the Atlantic, Anna?
Workplace wellness for sure, which encompasses everything that Sarah talked about. Um, and um, Safety, security of our frontline workers. We know that workplace violence is a topic that is one that we are talking about more here, but we know that that's a topic nationally as demands
Mm-hmm.
on our healthcare system evolve and shift. So there is, we want to make sure that people feel that they're bringing their whole selves to work and that they're going to go home safe at the end of the day and ready to come back and do it again the next day. I think cultural competency as our workforces get increasingly diverse is
Mm-hmm.
an area where we need to be finding ways to do more. And when I think about organizational culture, because in Nova Scotia, we make up the vast majority of the acute care settings in Nova Scotia, we can't program or curate culture as a corporate service. The culture is local, and how we help make sure that our frontline leaders and site leaders and directors in the organization understand how they are really important stewards of organizational culture in ways that could be bad or could be really good is important. So how do we make sure that our leaders have the competency and skills that they need to create an environment where our frontline workers want to stay? Um, so on, so there's all of that, and I think we have not fully, at least not in Nova Scotia, turned our mind yet to data and AI when it comes to the talent side of the house. There's a lot of conversation and interest in when it comes to data and patient facing, but when I think about what that could mean for us as a way to deliver services within the HR function, I think that we are all as a profession just getting our head around what that opportunity might present for us. So no shortage of priorities and no shortage of opportunities. Um, but it's nice that there is some consistency in the conversations across the country. We're certainly not alone the opportunities and priorities that we're trying to tackle.
Thank you. Yeah, I mean, I think some of what over the course of our conversation, I mean, we've talked on it a little bit around the sides, but I mean, a lot of it really is around, like, I guess the culture sort of aspect of things, and your roles and your strategic roles in fashioning culture, and then really, I guess the unanswered question, or assumed, right, is that why is culture important? And whether it's so many of our members across the country are listed as top 100, top 50, top employers in their regions or their cities or their provinces, right, being employers of choice. But I think you're also describing a much more highly competitive and a highly more evolving sort of marketplace, I guess, where people, even clinicians, which typically their pipeline was to go from a school into a healthcare organization, have many more choices to practice in community today than they did before. So why did they get to choose to go and work for Nova Scotia Health or Covenant Health or any number is really going to come down to the kinds of environments that people like yourselves are stewarding. So anything else that you would like to say then, in terms of summary, or anything I didn't ask that you think we should be talking about, or final words for you before we wrap up?
I mean, we could probably have a whole nother hour podcast on just one of the things we talked about today, but I really appreciated the opportunity to hear from Anna about what she's thinking about, and kind of compare that to where we're going. And I think that's one of the most valuable things that the healthcare can provides us, is this opportunity to not be alone on this journey, but to really come together with our colleagues across the country and hear what they're doing and share some of our trials and tribulations, but also celebrate our successes. So just really appreciate the opportunity. Thank you.
Thanks, Sarah.
I think there is a real opportunity for HR teams in healthcare across the country to think differently about how we add value. I said this and I mean it. One of the biggest reasons I decided to come to healthcare now is because I had a chance to come into the organization and see firsthand the caliber of people desperately trying to do HR work in healthcare that you wouldn't ever notice or see. It is an exceptional group of people who are really trying to do hard work.
Mm-hmm.
And that's really inspiring. And I would bet that that is true all across the country. So there is a real opportunity for us to change a conversation at a time that our voices are needed to help change the conversation. There is a lot of work to do. We are not perfect. We're not getting it right. But I think the more that we can be seen as a partner and, someone who's going to roll up sleeves and try to solve really impossible problems, I think the better off we'll all be if we can continue to find more spaces to do that together.
Thanks, Anna. And I would echo that. One of the great privileges of my career and my role is being able to work with HR professionals and like yourselves across the country, and you're wonderful, compassionate human beings that really do care, and very I think underrated and underthanked sort of segment of our health workforce and system. So for our listeners, find an HR professional near you and go say thank you. So much depends on the work that they do. So thank you both for a wonderful conversation, sharing your insights, and hopefully it propels others to walk in your footsteps.
Thanks for the opportunity.
Thanks. Have a great day.